Pregnancy is just this time of incredible transformation, right? And honestly, one of the very first places you might notice a change is in your breasts. So in this explainer, we're going to walk through exactly what's going on, why it's happening, and what it all means for you and your baby.
So, if you're pregnant, you've probably already noticed your body is doing some new and sometimes pretty surprising things. It is completely normal to have questions about all this, and believe me, you are definitely not alone in feeling this way.
You know, the most important thing to remember is that every single change we're about to talk about has a purpose. Your body is so smart. It's preparing for one of its most important jobs, nourishing your baby. These are all signs that everything is gearing up just the way it's supposed to.
Okay, so where does it all begin? Well, a lot of the time, the very first signs are things you feel rather than see. Let's dive into those early sensations and the first changes in size.
Do any of these sound familiar? Tenderness, a feeling of heaviness or fullness, maybe even some mild pain or tightness. These are such classic early signs. Sometimes they can even show up before you've missed a period. They're basically your body's first little announcement that something big is on the way. So what's actually causing these new feelings? Well, it's all happening inside your milk ducts. Think of them as this intricate network, and right from the get-go, they start to expand and get ready to carry milk. Your body is essentially starting the whole milk production process right from the very beginning.
And the scale of this change is pretty amazing. Your breasts can actually double in weight throughout your pregnancy. This is all being driven by a surge in the hormone estrogen and a huge increase in blood flow to the area. It's all working together to build the support system your baby's going to need.
Okay, so beyond what you feel, you're also going to start seeing some pretty distinct changes. Let's take a look at how the appearance of your skin, especially around the nipple, starts to transform. As you can see right here in this comparison, your nipples and the area around them, the areola, they might become darker, larger, and just more pronounced. You might also notice some little bumps appearing. This is all perfectly normal, just caused by those hormonal shifts and all that extra blood flow. And here's a really cool detail. That darkening of the areola, it isn't random. It's thought to create a clearer, more visible target for your newborn to find during those first attempts at breastfeeding. How amazing is that? It's just a perfect example of your body planning ahead. And here is a super crucial piece of reassurance that comes directly from our source material. While these changes in pigmentation can look pretty dramatic, there's absolutely no need to be scared. For most people, this is a temporary change that just fades away naturally after your baby is born. All right, now for a topic that can sometimes cause a little concern but is actually a fantastic sign: leakage. I know, seeing a bit of discharge can be surprising, but let's reframe it. Think of it as your body giving you a big thumbs up that it's ready to go. So what you're likely seeing is something called colostrum. And you've probably heard it called liquid gold, and that's for a very good reason. This is the very first super concentrated milk your body makes. Leaking a little bit just means that your body's production line is up and running perfectly.
So why is it so special? Colostrum is an absolute powerhouse. It's loaded with vitamins, essential minerals, and most importantly, antibodies that are going to protect your newborn. So seeing a little bit of leakage isn't a problem at all. It's like a sneak peek of the amazing gift your body is creating for your baby. And if you are experiencing some leakage, the care for it is really simple. Just gently clean the area each day, and maybe consider massaging in a little moisturizer or a safe oil just to keep the skin healthy and comfortable. It's really all about comfort and basic hygiene.
So, we've covered a lot of totally normal changes. Now, it's just as important to know what isn't typical. Let's be really clear and outline the signs that mean you should probably check in with your doctor.
Okay, so if you notice any pus or bloody discharge, or if a nipple suddenly turns inward and it's combined with pain, or if you're experiencing any severe and persistent pain, it's time to call your doctor. Please don't hesitate. Just reach out to your healthcare provider and get it checked out. So when it's all said and done, what's the big takeaway here? It's that your body is just remarkable. From the tenderness and swelling to the darkening skin and producing that first liquid gold, almost all of these changes are just signs of a healthy system doing exactly what it was designed to do, preparing to welcome and nourish a new life. What part of this whole incredible process fascinates you the most?